Today we're going to do a lower sensory and motor nerve conduction on the Cadwell Sierra Wave. We're going to start by, after you turn the machine on, we're going to double click on the Sierra Wave logo. In my case it's down in my bottom right hand corner, yours may be somewhere else. Locate it, double click it. Once it comes up, you're going to hit New Exam. You're going to put the patient's information in, last name, first name, male or female, very important. You want to put the birth date in as well. Once the birth date's in, you want to select your physician. And then from here we can go to custom information, patient complaints. You simply click on the complaints, and from here you've got a group of clickables that you can either hand type in or use these clickables. I happen to use these. So for instance, I'm going to put low back pain radiating to the bilateral hips with associated weakness, and I'm going to hit done. From here I'm going to go down to patient history exam, and you're going to want to hand type in what the doctor has on their exam. We want to just copy that right onto here. Once that's finished, you hit done, and then we can start exam. When you hit start exam, it's going to ask us what test we want to do. The only ones we're going to do are bilateral upper and bilateral lower, so we're going to select bilateral lower, and the test comes up from here. We're also going to talk about positioning on the computer, because there's a listing on this program that will explain and show you exactly where to place the pads and distances and what have you. Real simple. I'm going to show you quick before we get started. Once the main program comes up, you will go to Help on the top, single click it, and go down to NCV Setups. There you'll see a myriad of nerves that we do here and some that we don't. You just kind of pick out the ones we're doing. And for instance, since we're doing lower sensory, I'm going to go to lower limb sensory nerves, and the first one is sural anadromic. And it will show you the actual placements of your pads and your stimulation points and your distance in between. This is very helpful. If you've got any questions, you can always refer back to this, and it'll help out quite a bit. The first nerve we're going to do today is the right sural nerve. And we're going to put our pad placement on like the computer showed us. We're just going to place 2 of them on there for now. I'm going to place the tabs facing down. You'll see why when we get into this. One right here. Good. And we're going to take one of our grounds, which are the larger ones, and we're going to place it up here on the foot somewhere. We're going to take our wires from here, and we're going to place these on the pads. The black wire, in most all cases, you're going to notice, is going to go towards the patient's heart. The red one is going to go away from it. This is what they call active and reference. The black one is always active, the red one is reference, the green is for ground. We're going to place the green right up here. From here we're going to measure 14 centimeters from the center of the active or black electrode. 14 centimeters. I'm going to hold that with my thumb. I'm going to take out a pen, and I'm going to put a little black mark straight up and down. You do it straight up and down in case you need to move your electrodes up and down to get the nerve. This way, if you just put a dot, you may not have that. Now we're going to stimulate the sural nerve. We've marked our point from the center of the active electrode 14 centimeters up. We drew our straight line. We're going to stimulate. We'll go into this apparatus as we move along. A couple things you'll need to know now is this dial will increase and decrease the amount of stimulation we're using. I'm going to try about 25 milliamps to start with. You'll also notice the light on top here. If I hit this button, the light will change from left to right. This is called polarity. In most all cases on this, you're going to want the polarity or the light facing the electrodes, and that's how we're doing it on this one. So we're going to go ahead and stimulate this down here and see if we can get a signal. Okay, we got a signal. And it showed up on the monitor over here. One thing you'll notice is that the computer will try to always mark these correctly. In this case, it didn't. My wave is right here, and it marked it elsewhere. You'll notice there's a P and a T. The P stands for peak, which is peak of the wave. I'm going to move that over to the very top of this wave, and you do that just by clicking on it with the left mouse click and holding it. The T is for trough. Trough is the bottom of the wave. We're going to take that over to the bottom of the wave here. That is a correct wave for our Searle sensory. I'm finished with that, so from here I'm going to use this wand again, and I'm going to hit the number 2. Number 2 is always next. It's going to take us to the next nerve, which in this case is the right superficial perineal. You'll notice the screen changes to blank and it's ready for the next nerve. The next nerve we're going to do is the superficial perineal. The pad placement, as you'll see on your help topics, are going to be as such. We're going to take the reference and the active off. The reference is going to go right about here. Or excuse me, the active is going to go right here. The reference is going to go just a little bit past it, like so. We're going to measure 12 to 14 centimeters from the center of the active. Once again, I'm going to put my thumb there. And we're going to mark this with a nice long line again, once again, so we have room to move up and down if we need to. We're going to go ahead and stimulate the superficial perineal nerve, once again making sure that the polarity is correct. If it's not, your wave is not going to be correct either. Always make sure, in most all cases, and we'll go through the ones that don't, always make sure that your light or your polarity is facing the electrodes when you stimulate. We're going to turn this up to about 20 again, and we're going to try to stimulate at the same point. Okay? And you'll notice in this case the machine marked it correctly. We have our peak marked correctly and our trough marked correctly. We can move on into the motor, and to do that, once again, we hit number 2. Number 2 is the one that selects the next nerve, and in this case, it will show you right perineal motor. So we're going to go ahead and select that, and we're moving on. Okay, we're going to do the right perineal motor. Good news on the pad placement is the pad placement stays the same as the superficial perineal, so you don't have to move these when we go into the motor, and the first motor is the right perineal. The stem points are different, so you can note that on your help topics, or you can watch as we do this here. This machine, or this wand, also has a little button on the side that moves this the stimulator back and forth. I'm going to slide it all the way down. It locks in place. This makes it easier for me to stimulate on top here without having my fingers easy to touch these buttons. And so what we're going to do is we're going to take this up to, I'm going to take it up into the 30s or so, and we're going to place it right about here, and we're going to hit the stem button where my thumb is, and we've got a good wave. You'll notice it is marked correctly. In this case, with motors, instead of having peak and trough, it marks the beginning of the wave, which is onset. So you'll see an O and a P for peak. It's marked it correctly. We're happy with that. And we're going to move on to the second nerve placement for the perineal nerve. Motors have usually more than one stem point. So what we're going to do is we're going to hit store. When we hit store, it saves the first wave and gives me a chance to do the second wave. We're going to do the second part of that nerve now, which is going to be behind the knee. We're going to move right to it. You'll also notice that I'm going to hit this button and I'm going to move this the opposite direction so the prongs are facing up, because I'm going to stimulate behind the knee. Always pay attention to your polarity. Get gel on the tips. We're going to go behind the knee, right medial to that lateral tendon. We're going to check our milliamps. I'm going to go to about in the 40s. I'm going to place it here. I'm going to hit the stem button. And if you look back at the screen again, we've marked our second wave. So the motor has got 2, and it's also marked it correctly with the onset and the peak as well. Now what we need to do is we need to measure. The computer doesn't know how far of a distance that we traveled between our first stem point and our second. When we measure, we want to measure the closest stem point to the toes to the closest stem point to the toes of the second. And we're going to do this in centimeters. So I'm going to hold this to the first, the second, and this shows me it's 35 centimeters. So we're going to go back over here, and we're going to hit number 1. Number 1 is for measure. I'm going to select it, and I'm going to roll this up to 35. Once it's 35, I'm going to hit 1 again, which takes the measure away, and I'm done with that nerve. We're going to move on to the next one, which is the right perineal F wave. So I'm going to hit number 2 to move to it. Now the good thing about this, again, is we don't have to move our electrodes, our active and our reference electrode. We're going to keep those the same for the median F wave. We're going to take the stimulator, move it back to the down position, put some gel on it again. We're going to stim in that same point. We're going to stim in that same point here. Now I'm going to take it up to about in the 40s. I'll go to about 45 here, and we're going to stimulate that same point 1 time.
Polarity. F wave.
Can we go back? The polarity needs to be changed on this one for F waves. Unlike the other nerves we had talked about, we want to make sure that the light is facing the opposite direction of the electrodes for all F waves. And H reflex, we'll get into that later. So we're going to stimulate 1 point, the same spot that we stimulated for the right perineal, by the way. I'm going to do it 1 time. And what we're looking for a wave to show up over here somewhere, and I don't see one, so we need to continue increasing our stimulation, the amount of stimulation that we use until I get a good point there. You can just stay up here if you want.
Okay.
And make it in the way. And we're not getting anything yet. We're going to keep trying. Okay, I've got a little bump right here. This is what I'm looking for. So I want to do between 5 and 8 of these and try to get as many of those bumps as possible. Now, we don't hit store on this one. We actually want to hit the F1. The F1 is going to let me save this one and continue as many as I need. You'll notice when I hit F1 that that line turns purple and it gives me a second one. So we're going to try to get more bumps like this one. We're going to continue. Okay, we got enough good ones. That looks pretty good. So now we need to mark these. You'll see the straight blue line here. That straight blue line needs to be at the beginning of the average of all those bumps. So I'm going to take that blue line, I'm going to single click it, it turns yellow, and I'm going to bring it over to the beginning of those bumps. That completes the F wave of the perineal nerve, so we need to move to the next one, so we will just hit number 2, which is our next button, and it'll take us to the next nerve, which is the right tibial motor. For that one, we're going to take these 2 off. We'll leave the ground as it is. We're going to bring the foot over. We're going to place the active electrode right about there, reference electrode right about there. Now our 2 stem points are going to be right here and behind the ankle again. So we're just going to move right to it.
Behind the knee.
Behind the knee, yes, thank you. I'm going to bring the electrodes back up. Since I'm going to be this way, you'll notice the green light's facing the wrong way. We need to move it so it's facing towards the electrodes. I'm going to get a little gel. I'm going to turn this up into the 20s. And I'm going to stimulate right underneath here. Got a beautiful wave. I'm happy with it. We need to move to the second stem point since it's a motor. So to do that, we have to hit store. I'm going to hit store once. It'll turn that purple and make the next line available. So I'm going to go behind the knee again, change my polarity. I want the polarity facing this way, and we're going to stimulate. Okay, I'll go a little bit more. We want a little bit better stim. All right, that's as good as it's going to get. You can see I marked everything, the onset and the peak correctly. We still need to put our measurement in, so we're going to hit number 1. I'm going to measure from the first stem point to the first stem point of the second, which in this case is 340. So we already hit 1. We're going to roll this up to 34. Oops.
34, right?
34, and we're going to hit 1, which takes the measurement away. And then since we're done with that, we're going to continue to the tibial F wave, which is next. We'll hit 2 for that. The electrodes stay in the same spot. Change our polarity so the polarity is facing this way. Since it's an F wave now, we stimulate the exact same area. We're going to turn it up into the 30s. This one's a little easier to get than the perineal, so you don't need as much stimulation. as you'll see. We got a couple different waves here. We got one here and one way out here. We always want the one that's closer to the center of the screen. That's perfect. So I'm going to go ahead and hit F1, which saves that one and gives me the ability to continue. And we're going to do that. We're going to continue. We got several good ones. We're going to go ahead and average those out. We're going to click on that blue line, which now turns yellow when you get to it, and we're going to bring it over to the beginning of the majority of those bumps. That's perfect. We're going to continue to the next nerve, which in this case is the right medial plantar motor. And lucky us, the electrodes stay in the same spot for this one. And the stim point is the same as well. Make sure your polarity is correct. Turn it up into the 20s or 30s, however big the patient is. Stimulate one time. You get a really good bump up there. It's perfect. It's also marked correctly. We're going to hit 2 for next. And we're going to move to the right lateral plantar motor. For that one, we're going to take both electrodes off. We're going to come over here and put them on the opposite side of the foot. Almost the same placement as we did on the medial side we're going to do on the lateral. Once the electrodes are placed, you simply stimulate the exact same spot again. Check your polarity. Turn it up in the 20s or so. And hit it. We got a perfect wave right there. I'm happy with that. We're going to move on to the last nerve, which is the H reflex. We're going to hit 2 to get to that. From here, we're going to take all 3 of our electrodes off this time, the active, the reference, and the ground. I'm going to slide this a little closer to the patient, and I'm going to have the patient bend their knee. You may want to get around this way, to the back of the leg. Okay. This would be easier done if the patient was laying face down, but we're going to have to do the best we can here. The reference, or the red electrode, is going to go right here at the Achilles tendon, right above the heel. I'm going to place that there. The active electrode, which is the black, is going to go halfway, the midpoint between the heel and the crease of the knee, which is going to be right about here, and we're going to place the black one right there. The ground is going to go between the black electrode and the knee, so we're just going to place it up here somewhere. With F waves, just like F waves, H reflex, the polarity is going to be reversed. So we want to make sure that the green light is facing the opposite way of the electrodes. We're going to place this behind the knee again. We're going to turn this up probably into the 30s on this one. And once again, this depends on how big the patient is. The larger the patient, the more stimulation you're going to need. She's pretty small, so we're keeping the stim down pretty low. From here, we're going to stimulate one time. Okay. Now, this one's a little different. I want to look for the peak of this wave in between these two things here, in these two lines. The peak is actually obscured because it's up too high, so I'm going to take the wave and drag it down so I can see the peak. And there it is right there. That's perfect. I want to take my blue line, click it, it turns yellow. And for these, you don't want to mark them dead in the center of the hump. You want to bring it just a little bit to the right, which I've done here. Right there. Let go of it, and that is marked correctly. That is a proper H reflex. So from here, I can go ahead and hit 2, which takes me to the left side. For the purpose of time, I'm not doing the left side of the lower. The right side, you can just transpose that to the left. But I am going to show you how to save these and print these as well. Once you get down to the bottom, which will be the left H reflex, you can hit 2, which is next, and it's going to bring you back to the top of the screen. You'll also see a little colored AV button that will show up here.
I can't see you.
Get this.
Back up.
Right. Yeah. It's zoomed.
Are you bored of Jordan's voice already? Have a good one. Are we, did you get called back from the store?
I haven't checked my email yet. I haven't been in there because we're doing tomographies.
Okay, yeah, I think you were called back yesterday. I mean, that was...
Oh, he emailed me. I think everything's fine.
Yeah, okay.
I'll show it to you.
We gotta get the... Yeah.
Oh, yeah, price. I'll go over the price with you. That's what he emailed back about. Okay, so you'll see the AV button show up. And what we're going to do is we're going to click on that AV button, and you're going to see a picture of the legs show up down here. Now, if I'd have done the left and the right, which you're going to be doing, from here you're going to go to the view, and it says left lower limb. We want bilateral lower limb, so we're going to click on it and we're going to select bilateral. In this case, we didn't do the left, but you'll see on the bottom right and left. I can click on the second button here and rotate this around. If there was any nerve damage, the nerves would be in red. In this case, they're green, but I would do it to both. Swiveling these around give me the advantage of seeing more of the nerves, and if there's a pinched one that's red, I want to have that on the printed sheet, which is next here. So from here, what we're going to do is we're going to select, once we're happy with this, we're going to hit report on this machine. We're going to select it one time, and it's going to generate a Word document with the test results on it. That's going to take a couple seconds here to do. Once the Word document comes up, the last two things are to save it into the database, which is very simple, and then printing it, which is simple as well. You'll see once this document comes up that it's a normal Word document, and it shows the report down here. But on the top left, you'll see a little blue square, which is a disk. We want to hit that one time, which will save this into the database. And then the print icon is 3 over to the right. We'll select it. As soon as you hit it, it will print out. It's already saved, it's printed, and then you can move on to the next patient.